Hey everyone, welcome back to the channel. If you've ever been woken up by a painful leg cramp or watched a loved one dealing with those sudden sharp spasms, you know how frustrating they can be. But here's the thing. Many of those cramps, especially in seniors, are your body's way of saying, hey, I need something I'm not getting. In today's video, we're going to uncover the top 3 vitamins that can actually help stop leg cramps in their tracks. And no, we're not talking about obscure supplements or magic pills. We're talking about real, science-backed nutrients that your body might already be missing. First up is magnesium, the muscle relaxer your body loves but often lacks. Then we'll talk about vitamin D, your sunshine vitamin that plays a big role in muscle and nerve function. And last but definitely not least, vitamin B12, crucial for healthy nerves and often overlooked in senior diets. Whether you're a senior, a caregiver, or just someone wanting to stay ahead of the pain, this video will break it all down in simple terms and show you how to get these vitamins into your routine. So go ahead, subscribe, and hit that notification bell because you don't want to miss what's coming next. Ready to say goodbye to those leg cramps? 1. Magnesium. Magnesium is among the most important minerals in the body, and yet it is easily forgotten, particularly in regards to muscle function and the elusive, throbbing experience of leg cramps. For older adults in particular, magnesium is even more of a critical player, and a lack of this important mineral can be one of the most significant behind-the-scenes causes of those annoying cramps that jolt you awake in bed or turn walking into a chore. So what is magnesium, and what is so critical about its role in our muscles? Magnesium is a dietary mineral that is involved in more than 300 enzymatic processes in the body. It's responsible for everything from energy production to maintaining a regular heartbeat to bone health, and yes, nerve and muscle regulation. In the case of leg cramps, magnesium's most critical function is in assisting muscles to contract and relax normally. Each time you move a muscle, whether you step forward or just shift your weight, your body is depending upon a delicate transfer of calcium, potassium, sodium, and magnesium ions in and out of your muscle cells. Magnesium is a natural calcium blocker in that whereas calcium tightens muscles, magnesium causes them to relax. Without adequate magnesium, your muscles may be in a perpetual state of contraction that can result in cramping, spasms, and even tremors. Magnesium levels decrease naturally with age. Older adults also experience lower magnesium intakes in their diets and a higher risk of problems with absorption. Underlying age-related health conditions, gastrointestinal disorders, type 2 diabetes, and kidney problems lower the body's capacity to absorb or retain magnesium. In addition to that, medications that elderly people most commonly use, such as diuretics to treat high blood pressure or heart failure, proton pump inhibitors to relieve acid reflux, and some antibiotics gradually drain magnesium reserves. This places elderly individuals at a much greater risk of deficiency with a wide range of symptoms, among them muscle cramps. Leg cramps specifically occur during the night or afterward from exercise and can be sore and painful, lingering from a few seconds to a few minutes in duration. The pain is stabbing and sometimes lingers in the muscle for hours afterward. When the level of magnesium is low in the body, the muscles fail to relax properly upon contraction and result in muscle spasms involuntarily. It's not only athletes and those who exercise heavily who suffer from this. Older adults who walk and even stretch in bed can suffer from such cramps. In fact, older adults may experience chronic cramping from mild dehydration and magnesium deficiency. Due to this reason, magnesium is sometimes called nature's muscle relaxer. Studies have shown that magnesium supplementation can reduce the frequency and severity of leg cramps, especially in people with low serum magnesium levels. Although the research is still mixed when it comes to treating idiopathic leg cramps, those without a known cause, there's a stronger case for magnesium being effective when a deficiency is present. For example, one study found that magnesium supplementation helped pregnant women, who also frequently suffer from leg cramps due to changes in circulation and mineral levels, experience fewer and less intense cramps. The results may translate to seniors, particularly those who have confirmed low magnesium levels through blood tests. One of the reasons magnesium is such a powerful tool for seniors is because it doesn't just support muscles. It also improves sleep quality, reduces stress, and supports cardiovascular health. Better sleep alone can significantly reduce the risk of leg cramps, as many cramps occur at night during rest. A magnesium-rich routine can create a domino effect of benefits that go far beyond just eliminating cramps. When you sleep better, your muscles heal and recover more efficiently. When you're more relaxed, you reduce the physical tension that might contribute to spasms. And when your heart and blood vessels are functioning properly, your circulation improves, reducing the risk of muscle fatigue and cramps. So, how can seniors get more magnesium? The good news is that magnesium is found in many delicious and nutritious foods. Leafy greens like spinach and Swiss chard are great sources, as are nuts and seeds like almonds, pumpkin seeds, and sunflower seeds. Whole grains, beans, lentils, and even dark chocolate are also rich in magnesium. However, it's important to note that modern diets, especially those that rely on processed or convenience foods, are often low in magnesium. The refining process of grains, for example, strips away much of the magnesium content. Additionally, soil depletion from industrial farming means that even fresh produce can contain less magnesium than it did decades ago. This makes supplementation a practical and often necessary option for seniors. There are several forms of magnesium supplements available, including magnesium citrate, magnesium glycinate, and magnesium oxide. Each type has different absorption rates and tolerability levels. For example, magnesium citrate is more easily absorbed and can help with constipation as a side benefit, while magnesium glycinate is gentle on the stomach and especially good for people with sensitive digestion. Magnesium oxide is more common and inexpensive, but it's not absorbed as well. For seniors with leg cramps, magnesium glycinate is often recommended due to its muscle-calming properties and higher bioavailability. However, it's always a good idea to talk to a healthcare provider before starting any supplement, especially if you're taking medications or have underlying conditions like kidney disease. Dosage is another key factor. While the recommended dietary allowance, RDA, for magnesium in older adults is around 320 milligrams for women and 420 milligrams for men, individual needs may vary depending on diet, lifestyle, and medical history. Taking too much magnesium from supplements can lead to side effects like diarrhea, so finding the right balance is essential. Fortunately, when magnesium is consumed from food sources, it's very unlikely to cause any adverse effects, since the body regulates how much is absorbed through the gut. In conclusion, magnesium is an often overlooked but incredibly powerful nutrient for preventing leg cramps, especially in seniors. It supports healthy muscle function, nerve communication, and electrolyte balance, making it a key player in keeping your legs cramp-free and your body running smoothly. As we age, being proactive about magnesium intake, whether through food or supplements, can make a world of difference not only in reducing painful cramps, but also in improving sleep, reducing stress, and boosting overall wellness. So if leg cramps have been disrupting your nights or limiting your mobility, magnesium might just be the missing link your body's been craving. 2. Vitamin D. Vitamin D, often referred to as the sunshine vitamin, plays a far more important role in muscle health than many people realize, and its connection to leg cramps, especially in seniors, is both fascinating and critical to understand. Unlike many vitamins that are primarily obtained through food, vitamin D is unique in that our bodies can produce it naturally when our skin is exposed to sunlight. However, as we age, our ability to synthesize vitamin D through the skin significantly decreases, and factors such as spending more time indoors, living in northern climates, or wearing sunscreen regularly can all contribute to chronic vitamin D deficiency. What does that have to do with leg cramps? Quite a lot, actually. Vitamin D is essential for maintaining proper levels of calcium in the blood, and calcium is a mineral that's deeply involved in muscle contraction and nerve signaling. But here's the key. Without enough vitamin D, the body struggles to absorb calcium efficiently, which can lead to an imbalance in the minerals required for muscles to function properly. This imbalance can manifest in several ways, ranging from general muscle weakness to painful spasms and cramps, especially in the legs. When calcium levels do decrease because of inadequate vitamin D status, The muscles get mixed signals from the nerves and may experience involuntary contractions or cramps that may be painful and disruptive. This is most relevant to seniors because not only do they more readily experience low levels of vitamin D, but also because they're more likely to experience other conditions such as osteoporosis, arthritis, and circulatory problems that can exacerbate the effects of musculoskeletal symptoms from vitamin D deficiency. Researchers in studies discovered that older adults with low vitamin D levels experience more muscle pain, weakness, and nocturnal cramps than older adults with adequate levels of the vitamin. One large study in the Journal of Clinical Endocrinology and Metabolism determined that vitamin D deficiency was independently linked with increased risk of falls in older adults, and that many of those falls were caused by muscle cramping and instability, both of which result from a lack of adequate vitamin D. In addition, vitamin D receptors reside in muscle tissue. That also means that vitamin D impacts the way that muscle functions on the cellular level. Under adequate vitamin D conditions, muscle fibers retain their strength and flexibility, conduction of nerves is smooth and continuous, and random spasms and cramps become much less likely. Conversely, in the absence of these receptors because of inadequate levels of vitamin D, muscles suffer increased fatigue, malfunction, and cramping. Vitamin D's importance doesn't end in muscle function. It also regulates the immune system, fights inflammation, and even manages mood swings, both of which also impact the level of function and pleasantness in older age. But in spite of its significance, vitamin D deficiency is also one of the most prevalent nutritional deficiencies in the world and is most prevalent in seniors. Darker skin pigments, obesity, kidney problems, and digestive maladies such as celiac and Crohn's disease all detract from the body's capacity to create and ingest vitamin D. This creates a silent and significant risk of muscle-related symptoms that go misdiagnosed and untreated. So, how do seniors increase their level of vitamin D to help prevent leg cramps and enhance muscle health in general? There are three primary sources of vitamin D: sunlight, food, and supplements. Ideally, getting 10 to 30 minutes of sunlight per few days allows the body to create enough vitamin D on its own. But that is not always practical, particularly in colder climates, seniors with limited mobility, and those who are homebound. That is where diet and supplementation come in. Sources of vitamin D in foods include fatty fish, such as salmon, mackerel, and sardines, in addition to egg yolks and fortified foods such as milk, orange juice, and breakfast cereals. Meeting daily vitamin D requirements from foods is challenging, however, particularly in older adults. That is where vitamin D supplements come in. The recommended dietary allowance, RDA, of vitamin D is around 600 to 800 international units per day in older adults. But many physicians recommend higher levels, sometimes 1,000 to 2,000 international units per day, on the basis of blood levels and individual health factors. Keep in mind that vitamin D is fat-soluble and thus is stored in the body and has the possibility of accumulation over time, and taking excessively high quantities without the care of a physician can be detrimental to health. That being said, regular moderate supplementation is safe and effective in having blood levels in a state where function of the muscle is improved and cramp frequency is lessened. Many people report reduced leg cramps within weeks of correcting a vitamin D deficiency, along with increased energy and better mobility. Some supplement options include vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol, with D3 being the more potent and bioavailable form for most individuals. For seniors with existing muscle issues or recurrent leg cramps, checking vitamin D levels with a simple blood test can provide valuable insight. If levels are low, typically below 30 nanograms per milliliter, a healthcare provider can recommend an appropriate supplementation plan. Vitamin D also works synergistically with other nutrients, particularly magnesium and calcium, both of which are also involved in preventing leg cramps. Without enough magnesium, the body can struggle to convert vitamin D into its active form, and without vitamin D, calcium absorption is compromised. So these nutrients form a powerful trio that supports muscle relaxation and contraction. When balanced properly, they can dramatically reduce the incidence and severity of leg cramps in seniors. In summary, vitamin D is much more than just a nutrient for bones. It's a critical factor in how muscles function, how nerves communicate, and how well the body resists painful, random cramping episodes that can disrupt sleep, mobility, and daily comfort. For seniors dealing with regular leg cramps, ensuring adequate vitamin D intake can be a game-changing step toward relief. Whether through sunlight, diet, or supplementation, maintaining optimal vitamin D levels can help muscles work more smoothly, nerves fire more predictably, and overall quality of life improve in ways that are often underestimated. So if leg cramps are keeping you or someone you care about up at night, don't overlook the possibility that it might not just be hydration or posture. It could very well be a lack of vitamin D quietly undermining muscle function behind the scenes. 3. Vitamin B12. Vitamin B12, also called cobalamin, is a water-soluble vitamin that is important in maintaining the health of the nervous system and the production of red blood cells and DNA synthesis. But what most do not know is that it also has a large role to play in muscle function and in preventing muscle cramping of the legs, particularly among older adults. Unlike magnesium and vitamin D, which more directly affect the chemical mechanics of muscle contraction and relaxation, vitamin B12 acts behind the scenes to guarantee the nerves that operate those muscles to be working properly. That is because B12 is critical to production and maintenance of the insulation covering around nerves called the myelin sheath. This sheath is similar to insulation on electric wiring in that it helps the impulse of nerve signals to communicate from the brain to the muscles rapidly and precisely. In deficiencies of B12, the sheath becomes compromised and can be damaged and cause delayed or misfired signals in nerves that result in muscle twitches and spasms and the searing, painful, unexplained cramps that so frequently affect the legs and ankles. Older adults are at great risk of deficiency of vitamin B12 because of a number of reasons. First, with age, the stomach decreases the production of hydrochloric acid that is needed to absorb vitamin B12 from food. Second, older adults may be on medications that inhibit vitamin B12 absorption, such as metformin in diabetes and proton pump inhibitors in acid reflux. Thirdly, some older adults suffer from pernicious anemia, an autoimmune disorder that prevents the stomach from making intrinsic factor that is needed to absorb vitamin B12. All of these reasons allow vitamin levels to drop terribly low without overt indicators that something is wrong, until symptoms set in. These may include weakness, numbness, and tingling in the feet and hands, walking difficulties, memory problems, and of course, muscle cramps or spasms of the legs. In fact, one of the most typical symptoms of deficiency in older adults is peripheral neuropathy, that is a disturbance of the nerves in the extremities, and is deliriously characterized by burning, stabbing pains, and muscle cramp in the legs. They may also cause muscle weakness and problems with balance or coordination in serious instances. Leg cramps resulting from B12 deficiency are not only painful, they may also be a sign of more profound nerve malfunction that should be remedied at once. Fortunately, deficiency in B12 is detectable and correctable. Measuring serum levels of B12 is done with a simple blood test, and supplementation to restore low levels can result in quick improvement. In mild deficiency, depending on its extent, the deficiency can be treated with high-dose oral supplements, sublingual tablets that dissolve in the mouth, and in more serious deficiency, intramuscular injections. Injections become employed where absorption is defective and can rapidly relieve neurological symptoms, such as cramping. In some individuals, frequency of cramps in the legs is seen to improve appreciably in just a few weeks after starting treatment, even before the deficiency becomes clinical in nature and reaches a detectable level. Adequate intake of B12 may support long-term health of nerves and muscles. B12 is naturally found in animal-based foods such as meat, poultry, fish, eggs, and dairy products, which makes it easy to obtain for those with a balanced diet. But this poses a challenge for vegetarians, vegans, or seniors with reduced appetite or difficulty chewing and swallowing. In such cases, fortified foods or supplements become an essential part of maintaining optimal B12 levels. The recommended dietary allowance for vitamin B12 in older adults is 2.4 micrograms per day, but many experts suggest that seniors may need more than this, particularly in cases where absorption is compromised. Unlike some other vitamins, B12 is water-soluble, so excess amounts are excreted in the urine, making it relatively safe even at higher doses. Still, it's always wise to discuss supplementation with a healthcare provider to ensure that the correct form and dosage are being used. It's also important to understand that vitamin B12 does not work in isolation. It often works synergistically with other B-complex vitamins like B6 and folate, and together they help regulate homocysteine levels in the blood. Elevated homocysteine has been linked to increased risk of cardiovascular disease and nerve damage, both of which can contribute to poor circulation and cramping in the lower limbs. When B12 is optimized, along with magnesium and vitamin D, it creates a powerful foundation for nerve-muscle communication and overall muscular health. Moreover, B12 plays a subtle but powerful role in energy production at the cellular level. Every cell in the body contains structures called mitochondria, often referred to as the powerhouses of the cell, and B12 helps these mitochondria convert food into usable energy. When B12 levels are low, cells don't function as efficiently, which can lead to early muscle fatigue, weakness, and the kind of neuromuscular irritation that sets the stage for cramping. Seniors who complain of low energy, muscle stiffness, or vague leg pain may, in some cases, be experiencing the effects of an underlying B12 deficiency. For caregivers and family members, understanding this connection is important because it can help identify symptoms early and prevent long-term complications. One often overlooked aspect of vitamin B12 is its impact on sleep quality and mood, two factors that are indirectly related to muscle cramping. Poor sleep, especially when combined with elevated stress levels, can increase the likelihood of nighttime leg cramps. Since B12 helps regulate melatonin and serotonin levels, it contributes to a more restful, stable sleep cycle, which in turn supports better overall muscle recovery and relaxation. Seniors who get sufficient B12 often report better mood, clearer thinking, and deeper sleep, all of which create the right internal environment for healthy muscle function. So while it may not be the first vitamin that comes to mind when someone complains about leg cramps, B12 is absolutely essential for maintaining the health of the nerves that control the muscles and preventing the kind of electrical misfiring that leads to those sudden, painful spasms. In conclusion, vitamin B12 may not directly cause a muscle to cramp or relax in the way magnesium does, but its role in nerve health is so vital that any deficiency can lead to frequent, unexplained cramping, especially in the legs and feet. For seniors, ensuring sufficient B12 intake is a critical piece of the puzzle in preventing these cramps, maintaining muscle control, and enjoying a higher quality of life. Whether through diet, supplementation, or targeted medical treatment, maintaining healthy levels of this underrated vitamin can offer powerful protection against the discomfort and disruption of leg cramps in older adults. So to wrap it up, if you're dealing with leg cramps, especially as a senior, don't ignore the power of the right vitamins. Magnesium, vitamin D, and vitamin B12 can make a big difference in keeping your muscles relaxed and your nerves working properly. A few simple changes to your diet or supplements might be all you need to start feeling better fast. If you found this helpful, give it a like, subscribe for more health tips, and share this with someone who needs it. Thanks for watching, stay healthy, stay active, and I'll see you in the next video.